Hi everyone. Today we are going to discuss about vascular access. First one, introduction of vascular access. Vascular access is a method of reaching the bloodstream through blood vessels for medical treatment and procedures. It is commonly used to administer medication, fluid, nutrition, blood products and for procedures like hemodialysis. A good vascular access provides safe and efficient blood flow while minimizing the complications. In the patients with kidney failure undergoing hemodialysis, vascular access is essential because it allows the blood to removed from the body. It filters through the dialysis machine and return to the patient. It is often called a lifeline of dialysis patient. Next, definition of vascular access. Vascular access is a method of creating an entry in the bloodstreams through a vein or artery to allow medical procedure such as hemodialysis, administration of fluids, medications, and blood sampling or monitoring of blood circulation. In hemodialysis, vascular access refers to special created access sites and that allow the blood to flow from the patients to dialysis machines and back to the body of efficiently and safely. Then the importance of vascular access, it ensure an effective hemodialysis treatment. It maintain adequate circulation during the dialysis and helps to improve patient survival and quality of life. It reduces the complication when properly cared of. The types of vascular access means the arteriovenous fistula. It's a surgical connection between an artery and vein. It is preferred and most durable access for hemodialysis. Arteriovenous fistula or arteriovenous graft. It uses a synthetic tube to connect an artery and vein. It is used when the veins are unsuitable for fistula creation. The next one is central venous catheter. It's known as CVC, a catheter inserted into the large vein and usually in the neck, chest, or groin. It is often used for temporary or emergency dialysis access. These are the three vascular access of hemodialysis patients. Next one is AV fistula. AV fistula is arteriovenous fistula is good standard for hemodialysis access and created by surgically connecting an artery directly to vein. It usually in the arm to allow high efficiency blood filtering and it is the safest and most durable options, offering the lower risk of infections and clotting compared to graft or catheters. The AV fistula procedures are vascular surgeons perform the usually outpatient. It's 1 to 2 hours procedure and often under local anesthesia. It's a maturation time. The vein needs to 2 to 3 months, sometimes longer or mature. It's enlarging and strengthening before it can handle the needles used for dialysis. The maintenance of AV fistula, it's like rule of six and often used to check the maturity or vein diameter greater than 6 millimeter and depth to less than 6 millimeter from the skin. And flow rate is increasing the 600 ml per minute. Then fistula care and complications. First of all, check the patients must check off thrill to ensure the fistula is flowing like properly. The risk is low. Complications can include narrowing, it means stenosis and blood clots or infections. Preparations, the surgery is typically done the month before starting dialysis to allow for healing and maturation. Common types are radiocephalic, then brachiocephalic and brachiobasilic. Radiocephalic is created at the wrist and radial artery to cephalic vein. Brachiocephalic Site is created at the elbow. It's connected to the brachial artery and cephalic vein. The brachiobasilic is created in the upper arm. Brachial artery to transpose the basilic vein. AV graft means arteriovenous graft. It's a minor surgical procedure that creates the high flow of access point for hemodialysis by using a synthetic tube to connect an artery directly to vein. It is primarily used when a patient's natural veins too small and weak or blocked support the AV fistula. The rapid lateness, unlike fistulas, when can take months to mature. A graft is typically ready to use to 2 to 4 weeks and placement. It is usually placed in the non-dominant arm, but surgeons may also place it in the leg or chest wall if necessary. The procedure of AV graft means performed an outpatient surgery, often is under local anesthesia where synthetic tube is tunneled just the skins to connect the vessels. The last one is central venous catheter. Central venous catheter is also known as central line. It's a thin and flexible tube inserted into large vein, typically in the neck, intrajugular site. Chest means subclavian or groin is like femoral. Unlike a standard peripheral IV that goes into small vein in hands or arm, in central venous catheters is advanced until tips to resist in a major vein near just inside the heart, especially the superior vena cava. The primary use of central venous catheters is healthcare providers use central lines for treatment and that long term difficult to administrate through the standards. The IV's long term medication administering chemotherapy and long term antibiotics or parenteral nutrition. It's an irritating substance giving certain medication that can damage or cause pain. In smaller peripheral veins, frequent access, it allowing for repeated blood draws and transfusions without multiple needle stick. The specialized care of monitoring central venous pressures or performing dialysis. Common type of central lines are first one is non-tunneled catheter, PICC lines and tunneled catheters, implanted ports. Non-tunneled catheters, these are for short-term use. Up to 3 weeks are typically inserted directly through the skins into the vein. Peripherally inserted central catheters means a specific types of non-tunneled line inserted to the arm vein and threaded into the heart. These can stay in place of several months. Tunneled catheters tunnel under the skins before the entering the vein and which is reduce the infections and allow them to remain months to even years. Implanted pause. It's a device that placed entirely under the skins, usually on the chest, that is assisted by the needle through the skins and they're common for chemotherapy and can last for years. Benefits and risk of central venous catheters. Benefits, it's reduce the number of needle sticks and allow for multiple medications to be given once through the different channels like lumens and provides a reliable way to get treatment long periods. The risk means the primary concern is infections, central lines associated bloodstreams infections, but the other risks included the blood clots, bleeding during insertions or collapsed lung. Pneumothorax is placed in the chest. Advanced of vascular access. First one is durability for long-term care, then reduce the patient discomfort and efficient treatment delivery. During long-term care means device like the implanted pose and last for years and ideal for patients need to recurring treatment, but the remains to normal daily routine such as swimming or showering. Then reduce the patient discomfort in specialized access point. Central lines allow providers to draw on the blood, deliver medicines and multiple times without repeated needles, protecting the veins from the scarring and pain. And the efficient treatment delivery system means for dialysis patient AV fistula provide higher blood flow rates and leading more efficient waste removal and potentially shorter treatment section. Disadvantages of central venous catheters. The main disadvantages, particularly of hemodialysis, include thrombosis. It means blood clots, infection, stenosis, narrowing. This complication leads to access failure and require frequent maintenance procedure of the creations of new access site. The next disadvantages of central venous catheter: Steele syndrome and aneurysm. Steele syndrome means the excess of means steals too much blood away from the hand or limb, causing pain, coldness, or even tissues like ischemia. Then aneurysm means over time the pressure is excess can cause the blood vessels walls to bulge, which can potentially rupture and cause severe bleeding. Complication of vascular access. Its example, first one is peripheral IV lines, central venous catheters, arterial lines. Dialysis access is broadly grouped into mechanical, infectious, and thrombotic others. First one is mechanical complication. It's a arterial puncture during the central line insertion, hematoformation and pneumothorax, hemothorax, subclavian internal jugular access. The next point is air embolism and catheter malfunction malpositions. Next, infectious complications like local site infections, catheter related bloodstreams infections, sepsis, tunnel infections, and exit site infections. Thrombotic complications means venous thrombosis and thrombocytopenia. Then the most common peripheral lines catheter circulations due to clot embolism, pulmonary example like pulmonary embolism from thrombosis. Conclusions of vascular access: it is essential components in the management of patients requiring hemodialysis and other intravenous therapies. All functionings and vascular access provide safe and effective blood for treatment. It is improving the patient outcome and quality of life. The main types of vascular access include the arteriovenous fistula and arteriovenous graft and central venous catheter, each having specific indication and advantages limitations. The proper creations and maintenance and monitoring of vascular access are important to prevent the complications such as infection, thrombosis, stenosis, and access failure. Early detection and appropriate nursing care play a major role in prolonging the life of access site and ensuring successful dialysis therapy. Thank you.